All right, so yes, we have our next presenter, Denise. There you are, Barbut from Enterin. Looking forward to hearing your presentation.
Well, thank you very much. Michael and I are the co-founders and respectively CMO and CSO of the company. So we're presenting together our joint efforts. We're talking about a new group of hormones that we've discovered, endogenous hormones, with extraordinary rejuvenating properties. They're amino steroids, and we're developing them at Enterin for the treatment of neurodegenerative and metabolic disorders. The grander vision is, of course, in line with the mission of the conference, which is generally to delay the aging process itself, to prevent neurodegeneration in the first place, and to prolong a healthy lifespan, not just extend the lifespan. And I hope to convince you that the compounds are doing a number of these things at the very least. So we've got two groups of steroid hormones that reverse symptoms of neurodegenerative diseases. The lead compound, Ento-1, targets alpha-synuclein aggregation in enteric nerves and restores neural signaling between the gut and the brain. We've got data to date from about 200 patients with Parkinson's disease. We're finishing off a phase 2b study, randomized phase 2b study. And we've shown already that it reverses constipation, circadian rhythm, loss of smell, sleep, dementia, and hallucinations. Our second compound, Ento-3, reverses central insulin resistance, sensitizes to insulin, and animal studies predict its potential for the treatment of obesity, diabetes, NASH, Alzheimer's disease, and whatever else. So starting off with Parkinson's disease and Ento-1, it's a common condition. It's diagnosed still to this day on the basis of motor symptoms and treated with dopamine that does nothing for the progression of the disease. Non-motor symptoms are actually a much greater burden to the patient and represent the greatest unmet medical need, are very poorly treated, and there's plenty of room for improvement, and that's the area we're sort of focused on, dementia and hallucinations. A little history of Parkinson's disease. Parkinson's disease originates in the gut decades before a diagnosis is made on the basis of motor symptoms. And it begins typically in childhood with accumulation of alpha-synuclein, a protein made by neurons in the enteric nerves to defend the nerves and the surrounding region from a GI infection. So you get a GI infection, the nerves start making alpha-synuclein, they call in the immune system, they try and confine the infection, and the vast majority of cases they do, and then they go back to baseline production levels, except in a few individuals who will ultimately get Parkinson's disease. In those, it's not turned off. Alpha-synuclein production continues because there are bad infections, or their white cells aren't reacting the right way, or they're making too many copies, etc. And over the years and decades, it accumulates in enteric nerve cells, clogging up the nerve cells with the aggregates of alpha-synuclein and ultimately leading to constipation, symptom number one, typically at the age of 20, 25. In fact, if you follow college students that are constipated versus those that are not, you'll find that the subsequent incidence of Parkinson's disease is about 15-fold among those that are constipated. The years go by, more alpha-synuclein accumulates, and the communication between the neurons in the gut, the enteric neurons, and the brain progressively becomes muffled. The areas specifically affected are the brainstem and the hypothalamus, the first sort of in line into the brain, and the circadian rhythm goes. The circadian rhythm, of course, is mission critical for all vital functions, not just for sleep-wake cycles, but the first thing that's noticeable clinically is impairments of sleep, Rem Behavior Disorder, depression, anxiety. This is all decades before a diagnosis. Year zero, ultimately, the patient might develop a motor symptom with further destruction of the substantia, and it dawns on somebody to call it Parkinson's disease, and then that progresses, cognition deteriorates further, psychosis supervenes to the normal, typical picture we see in late-stage Parkinson's disease. So a word about, I'm just trying to get this thing up here. A word about circadian rhythm. It's intimately linked to dementia and psychosis, both to the onset and to the speed of progression. On the left, if you can see my cursor, as a normal circadian rhythm. This patient neither has nor will get Parkinson's disease nor Alzheimer's disease. This on the right is a very abnormal circadian rhythm. This patient either has or will get a neurodegenerative disease, and when he does, it'll progress a lot faster. So circadian dysfunction is very important. Nobody has ever managed to reverse it. It's present in all neurodegenerative disorders, from Alzheimer's to Parkinson's to Huntington's to schizophrenia, and indeed autism at the other end of the spectrum. So how does ENTO1 help any of this? It's a compound that Michael discovered in the dogfish shark. This is a synthetic derivative thereof, given orally. It is not absorbed into the systemic circulation. It gets into the gut, it enters the enteric neuron, and it purely electrostatically displaces a number of misfolded proteins, and specifically alpha-synuclein, from nerve cell membranes, restoring the firing ability of these neurons. So here is a single cell in vitro. The green fluorescent stuff is alpha-synuclein aggregates stuck onto it. And when we put a few drops of ENTO1 onto this, you'll see how it displaces within seconds alpha-synuclein, as you saw there, from the membrane into the membranes into the cytoplasm, from whence it can be cleared. In a genetically modified model of C. elegans on the right, that accumulates great big red globs of alpha-synuclein in its muscle in this case, and soon after birth, within days, develops a movement disorder that's supposed to simulate Parkinson's disease. If you take these same C. elegans and from day one, feed them ENTO1 in their broth, you can see right bottom that all the alpha-synuclein aggregates but one have become soluble, have disappeared, and the animals never develop a movement disorder. So in this case, we've completely prevented the onset of a movement disorder in these animals. It also restores the excitability in enteric neurons and increases colonic contractions. So in a PD model, a rodent model, if you take an enteric neuron and you zap it, you might just get one little miserable action potential. It's not working, it's clogged up with alpha-synuclein. If you flush it through with some ENTO1 and you zap it again, you'll see this time you'll get a whole pulsation of action potentials, showing that you've now restored the normal firing potential of this neuron. It can now speak to its fellow enteric neurons, generate a peristaltic motion. Here, each little volcano is sort of an attempted motion. You can see that all these movements are very irregular contractions. They're irregular, they're infrequent, they're low amplitude. And if you flush this piece of gut through with ENTO1, you can see now the rhythmic, high amplitude, very regular peristaltic movements that can end up giving you a good bowel function. That's how you overcome the constipation. And constipation is not the only thing you overcome, but the communication between the enteric neurons, newly restored firing ability, and their ability to speak to the vagus nerve fibers that then take that message up to the brainstem and the hypothalamus and change the vagal signal, the single fiber recording, from this to this. And from here, where you give the drug, within minutes, massive amplification, prolonged amplification of the vagus signal going up to the brainstem. And we now know and are about to publish the fact that it's not any old signal, it's specifically a serotonergic signal that is amplified at the very least, and that this is partly also to do with the fact that we block the monoamine transporters and increase the effective amount of serotonin around in the gut to stimulate the vagus nerve. And then we get up into the brain, and we've shown on brain imaging that you get certain massive activation in red of the paraventricular thalamic nuclei, areas that have everything to do with awakening and alerting and attention and task performance, and of course of the brainstem, of the nucleus tractus solitarius, and profound inhibition of the entire cortex responsible for vision and subcortical structures that have anything to do with visual image processing, lateral geniculates, superior colliculi, etc., and anteriorly of the olfactory cortex. So if I play this video, it'll rotate and you'll see the green inhibited areas there, the cortical areas being inhibited. This is presumably how we inhibit hallucinations and these paraventricular thalamic nuclei that are waking up the patient and focusing its attention. And this is just a cross-section showing that the untreated animal, the treated animal, these are the paraventricular nuclei. In cross-section, this is where they live to wake you up and improve your memory. And this is where the NTS and nucleus tractus solitarius lives in the brainstem also lighting up. Contrarily, these are the anterior olfactory nuclei that are inhibited, and all the cortical and subcortical visual areas that are profoundly inhibited from this compound. So in the clinic, we've completed 2 studies. RASMET was the first, CARMET's the second, about to finish. In total, it's about 200 patients. The first one's published, the second one is about to finish. The first one was 50 patients with Parkinson's disease and constipation. The second one was 150 patients, randomized, placebo-controlled Parkinson's patients with constipation. And the goal of the exercise was to show engagement of the target organ, that at least we could engage the enteric nerve where we're landing and show that that is indeed reversing and functioning as it did in the animals. And so we treated them for 25 days in escalating daily doses, starting at 75, going up to 250. And we fixed their dose when they reached a prokinetic bowel response and then washed them out. And in both trials to date, we've shown constipation is reversed in a dose-dependent manner in over 70%. Circadian rhythm normalized in a dose-dependent manner. Hallucinations were eliminated in 11 of the 12 patients who had hallucinations. Dementia was reversed, even motor symptoms improved, and there were no significant safety issues, as you might expect from a compound confined to the GI tract with no systemic absorption. The majority of the adverse events were nausea, vomiting, and diarrhea. And to give you a couple of examples, this is a specific case showing you how we reverse the circadian rhythm. This is waking time. This individual before treatment is waking up at 2 a.m., 4 a.m., midnight, all over the place, and then gets treated. And within 2 or 3 days is now waking up on the dot, 7 o'clock every morning. And if you look at skin temperature, also has a circadian variation, no circadian rhythmicity whatsoever until treatment is initiated here. And then within 4 or 5 days, boom, 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 beautiful circadian rhythmicity. First ever demonstration of a reversal of the circadian rhythm. And in one portion of the study, we did one questionnaire and compared it with the bowel symptoms. And what you see is, that's the first portion of the second study. There were 6 patients in that portion that had hallucinations. 5 of them were on treatment, 1 was on placebo. You can see in the treatment patients, their hallucinations got better. This is SAPS-PD score, went from 11 to 4. Down is good. Down is good, down is good. And one goes down and the bowels improve. Hallucinations go down and the bowels improve in the appropriate direction, which is perhaps no surprise, but nice to see. And in the placebo patient, neither hallucinations nor bowel improved. And in dementia, it was not a dementia study, so most patients were normal. This is baseline MMSE score. This is improvement. But you can see is the more demented they are, the more they improve. These are the officially demented lot. And they improve quite substantially in the short treatment period, and that's presumably due to the activation of the paraventricular thalamic nucleus. So based on that, we're now continuing with 2 studies, one in PD dementia, one in PD psychosis, and we're raising money for that. A couple of words about ENTO3, a compound with a novel mechanism of action to treat diabetes. It increases insulin sensitivity at the level of the brain. It targets PTP1B and inhibits it. It's an enzyme that downregulates the insulin receptor. It rapidly corrects blood glucose and insulin in diabetic rodents. It induces rapid and substantial dose-dependent weight loss. It improves fatty liver, normalizes liver enzymes. A single dose has a really prolonged effect. And the pharmacological effects are presumably from, they are altered autonomic signaling from the hypothalamus via the brainstem to the peripheral organs. And here are some examples there. These are 5 doses, 3 days apart, in lean mice, showing a dose-dependent weight reduction. And in rats, single intracerebroventricular dose causes weight loss, showing that the target organ is in fact the brain. And in obese diabetic animals, a fuller metabolic picture here. We have a pair-fed group, an ENTO3 group and a control group, as well as a normal group. Pair-fed means they get as many calories as the ENTO3 group to distinguish the effects that are due to weight loss alone from those that are due to something above and beyond weight loss alone. Weight loss, you can see compared to control, is down in ENTO3, a little less in the pair-fed animals. Serum glucose is halved after 5 doses. not so much in the pair-fed animals. Serum insulin is halved, not in the pair-fed group. Ghrelin goes down by about half, actually goes up in the pair-fed group because they're starving. And liver enzymes go from sky high, 700, down to almost normal in the treated animals, not so much in the pair-fed group. And if you look at the brain by the same imaging as we did for ENTO1, you can see a massive activation, as a CFOS activation in over 40 different midline structures that have everything to do, this is hypothalamus and the same paraventricular thalamic nuclei, and all the brainstem regions that have everything to do with energy, balance, and autonomic function in one form or another. And based on that, we're starting human studies in the spring, starting with obesity and diabetes and hopefully progressing to Alzheimer's disease. We too are looking for corporate partners for that as we go forth. But I just wanted to end by showing you, going back to the spirit of the meeting, that we've done some Alzheimer's studies and that survival in a very aggressive tau model of Alzheimer's disease, a P19 model, is massively improved. And this is with animals. These animals are almost all dead by 13, 14 months. And treatment begins well into their Alzheimer's disease about here at 8.5, 9 months. And these animals just don't die. 14, 15, 16 months, we had to end up killing them because there was no room in the lab to preserve them. And I just wanted to show you a video of what they look like. Here's an animal. You can see the hind legs are stiff and not moving. It's got a kyphus, you will notice. And when it's put down, it just sits there. It moves very slowly. It doesn't really explore the cage. Whereas the treated animal, that's now 15 months old, his hind legs are moving like crazy. It wants to be put down. When it hasn't got a kyphus, when it's put down, it moves on awful lot faster and explores all four corners in much greater detail and looks exactly like the young animals. In fact, at one stage, we had to test them to make sure we had the right ones because they were behaving like the non-Alzheimer's control animals. So in summary, ENTO1 has finished off a couple of randomized studies and has progressed into PD psychosis and PD dementia trials. And we're currently raising 32 million for that. And we've raised 60 million to date. ENTO3 is beginning human studies in the spring. And we've got enough money in that in our current raise to cover the phase 1 studies there, but would love to get some help from a corporate partner to carry on into later stage studies with that one and a whole pipeline beyond. And this is the team. That's Michael. That's myself. And with that, thank you very much.
Wow, that you were doing a lot. That was really impressive. And yeah, I guess my first question, because all of this is based on the fact that you have discovered new hormones. It's always shocking to me that new things like this get discovered because you kind of, I mean, I think most people just think we've already know what hormones are there. Can you tell us the story of how you discovered the new hormones?
Yeah, Sonia, this story began a while ago in a search I made while I was at National Institutes of Health for, believe it or not, antimicrobial substances. And we looked at the dogfish shark at the time because it's a primitive animal with very, very primitive immune systems. And in the search for those antimicrobial agents, we discovered the existence of a strange chemical family of antimicrobial agents. And these were cholesterol derivatives that had, or bile salt derivatives that had polyamines associated with them. And they were quite impressive antimicrobial agents. But as we began to study them in animals, we realized they had pharmacologies that were unanticipated. We studied those for a very long period of time, discovered mechanisms of action. And 2 years ago, we decided to look at mammals. And knowing a lot about the chemistry now and fair amount about the pharmacology of the shark molecules. We looked in the brain, believe it or not, of the newborn mouse. And in the brain of the newborn mouse, during the first few days of life, a new family of hormones, very much like the shark, poke their heads out. And we captured them. And we captured those hormones, unprecedented in chemical structure. We've synthesized them, and what Denise has showed you represents a portion, just a portion of the work that we've done with these hormones. That's how
Right.
they discovered.
Yes, I mean, hormones are very
Serendipitously.
powerful. Well, I guess that's how science moves forward, isn't it? You're looking for
Yeah.
one thing and you find something else. Yeah, hormones are powerful things. I mean, it's really incredible the breadth of what you're doing. You're already in humans for Parkinson's, and you're looking to go into humans for diabetes.
Friend.
Sorry?
I see an old friend.
Dennis Purcell.
Yes, he's going to be our next moderator.
Hi, guys.
So you've raised 60 million. Is most of that, did you get non-dilutive funding, or is it mostly investment money?
Actually, I lie. We got to about 65 million by now because we're into the 32 million. So we've raised 65. We're looking for another 25. We intend to close on that by the end of the year and go into a crossover round, an IPO or direct to IPO next year. Only 3 million or so is non-dilutive funding. The rest is all institutional investment.
Got it. And Dennis, welcome. Do you have some questions since you know the team?
No, not for now. Thanks.
Right. How are we doing on time, Adrian?
Well, we are ready for our next presenters and also for our next moderator. So you can wrap up if you wish, Sonia.
All right. Well, thank you for having me here. All of these companies have been really great and super inspiring. I'm going to make sure I go and take better care of myself and exercise and eat well so that I'm alive long enough to be able to benefit from all of these technologies.
And thank you so much. You've been a terrific moderator.